Welcome. I'm Laura Siminoff, Dean of the Temple University College of Public Health. And joining me are our faculty experts, Graciela Jaschek, Sarah Bass, Krys Johnson, and Heather Murphy. All of us want, obviously, to get back to life as we used to know it, but we have to do so without causing more infections and deaths. So today we're going to talk about this and really focus on how we can do that, how other countries have been doing it, and what this all means. So we're hearing a lot about reopening. In fact, yesterday I noticed that the New York Times had a map that notes which states are open, partly opened, or still not open. So Graciela, can you first talk a little bit about what this means? What does it mean to be closed or partly closed or reopened or opened?
The answer is made difficult by a lack of consistent national response, the politicization of COVID-19, and the painful effects of a plummeting economy. So states are pushing ahead with policies about reopening that are very different. There is so much uncertainty about the pandemic that it is difficult to balance what we are learning about COVID-19 in real time with rapidly accelerating economic needs. But reopening means restrictions are going to be lifted, and some sectors of the economy, like construction or manufacturing, will restart faster than other sectors, like restaurants, hair salons, or sports events. The other thing we have to keep in mind is that reopening needs to be balanced with the risk of a second wave of infection that may result from that, opening. Lifting those restrictions, and what we may see is once again the need for practicing social isolation and diminishing economic activities.
Mm-hmm. So what exactly are the criteria for reopening?
Traditionally, the CDC has been the public health agency that local governments and the public turn to for science-based guidance during public health crisis. But the current administration has shifted that responsibility to the states to make their own reopening decisions. The administration has provided, however, with general guidelines that recommend phased reopenings, and they urge states not to lift stay-at-home or travel restrictions until they reach at least a 14-day period in which the number of COVID-19 cases are steadily going down, hospitals are not overwhelmed, and there is a robust testing in place. More specific reopening criteria are left to states, to state level authorities at this point, and often depend on local conditions within the state, each state jurisdiction. Mm-hmm. So nationally, the results we are seeing are uneven, but they reflect different state level measures for social distancing, testing, contact tracing. And not surprisingly, the rules guiding the reopening of businesses also vary from jurisdiction to jurisdiction.
Yes, so Heather, what has been the experience of other countries with this process?
So Laura, as other countries have opened up, there's been really a new way of life. It's clear that we're not going back to the way life was before the pandemic. So to give some examples, in Spain, they've been on like one of the most strict lockdowns, and they finally just opened up a little bit to allowing kids outside with an adult for 1 hour a day. Some countries have chosen to start sending little kids back to school, such as France, while others are focusing on maybe sending older kids back to school, like in Germany, Greece, South Korea, and Portugal. In China, if we look at people going back to work there, masks at the workplace and different distancing strategies such as staggered lunch times, only one person per table. Elevators are cordoned off with little squares so people can, they actually can't be more than so many people in an elevator, and they're facing the outside of the elevator and not the inside to not expose one another. They're doing temperature checks and reviewing people's, like they have a QR code tracking their health on their smartphone. And basically if they've been in contact with someone who might have had COVID, they may not be allowed into a restaurant or their workplace. So they're doing really strict tracking there. But it's a bit early for us to tell what the impacts of these actions are. There is a little bit of resurgence in cases in that second wave, which is to be expected. But what I do want to point out is that these countries have had really a better handle on their cases than we do, and we're already opening up. And so I'm just going to show a figure of a couple countries. So if we look at France, you can see that they've got this really nice curve coming down, and then they've maybe got a little bit of a resurgence here. And then Spain, you can see that they've been decreasing for a really long time, and now they're only just opening up this little bit. And then if we look at the United States, like, look at where we are. We're still really at this plateau, and then we're talking about opening up. And so I think we have to be really thoughtful and mindful that this could have a larger kind of second wave and a spike in cases if we open up too quickly and not in the inappropriate manner.
Yeah, and you know, you're showing that, but my understanding is that if we pull New York out of that, what we see are overall cases are still going up in the United States.
You're right, Laura. I didn't pull that graph, but yeah, if you actually pull out the New York cases, really the United States is increasing, and only New York has been the kind of the sustainable decrease across the US.
So the other thing I wanted to ask you about is that, you know, the states are doing very different things. We have 50 states. It's almost like having 50 different countries deciding what to do. I kind of noticed looking at some of those maps that the state's status in terms of where they are in the epidemic doesn't necessarily map onto what the state is doing. So for example, Arizona and Mississippi are showing as just about to reopen, but there are also states where the numbers of cases are rising fairly rapidly. So what does that mean for them? I mean, what's going to happen to them? Why are they opening?
To be honest, Laura, I don't know why they're opening. I think it's really risky, and they're risking people's lives. And at this stage, it seems like the economy is really the priority over public health. And as you can see by these curves, like you said, Arizona and Mississippi, I pulled those two out, they're just climbing. And so if they open up, they're just going to keep climbing. And then you look at Pennsylvania, and we're at least coming down, and we're doing a bit of like strategic opening in certain counties, but we're not opening up Philadelphia yet. And we're on the downward trend as opposed to kind of on this upward trend.
So what do you think about that? So here we are in Pennsylvania, and every day I look at where we are with all the counties, and clearly the epicenter, not unsurprisingly, of the infection is here, although Pittsburgh has quite a bit. Obviously, cities have many more cases. There definitely are some counties that are almost completely, as far as we know, COVID-free. But there also are quite a number of rural areas that have surprisingly large numbers of cases. Given that we do not have borders around our states, around our counties, what do you think about the idea that Pennsylvania will be opening up some counties first, others remain more or less in lockdown?
I think it's an interesting strategy by the governor, and I think maybe it'll work, but the problem is that there are no borders, like you said. And so what's stopping one person from going to one county and everyone coming to Philadelphia to get takeout and then come back with coronavirus or whatever, because people can move around. At least with a stay-at-home order that's consistent, people should not really be leaving their counties and leaving too far away from home. So it's risking a spread into those counties that have no infections, and then we could lose momentum. But I can see the position the governors are in, and they're getting pressure to open the economy. So maybe it's an okay approach to try, as long as they shut down quickly as soon as they see something emerging.
So Sarah, so obviously we've just finished discussing there's an inconsistency of opening up states, and even within states there's variation county by county. It must be really confusing for the public to know what they can and cannot do. So what do you think this effect will be on behavior and how people are or not protecting themselves?
Yeah, I mean, it's really hard to maintain things that aren't natural to us, like social distancing or staying at home. There was a great article yesterday in The Atlantic that kind of likens this to abstinence-only education. And, you know, we in public health know that abstinence-only types of programs don't really work. And that's kind of what we are doing here, where we're saying that, you know, people have to stay home, they have to do X, Y, and Z. So unless you're, you know, agoraphobic, most of us are used to being social and to have, you know, be active in places other than our houses. So the longer things go, the harder it is to kind of keep consistent with those recommendations. I think that's especially true now as the states do kind of quote open up, since all states are doing it differently. And as Graciela said, there's a lot of varied and kind of inconsistent messages about why we should or we shouldn't open up. And you know, even here in states like Pennsylvania, where some counties are more open than others, you know, it just becomes really problematic. You kind of have these two issues at play. You know, one is this kind of natural inclination to be social and to be kind of quote unquote normal. And the other is, you know, how much we still have to do, and that these both kind of lead to people to believe that they don't need to do things like socially distance anymore, even if we're saying, well, you should if you're in Philadelphia, just like Heather said, but you shouldn't if you're in, you know, another county. I think, you know, it's kind of a catch-22 for public health in many ways. The social distancing we did has flattened the curve in many places, which makes people think that that's all we had to do. And now we're saying, you know, you still have to do it because we might potentially have another wave of infection. And now people aren't feeling that risk anymore. So the abstinence message that we're having, especially the longer the time period goes on, just isn't working.
Right. So Krys, we were already talking about Pennsylvania, but can you tell us a little more about what parts of the state are reopening, what's not reopening, and then maybe talk in a little more detail about Philadelphia, because we're all in Philadelphia, where we are with it, and what you think we need to do to really get a handle on this epidemic.
Sure. So Pennsylvania, in contrast to some of the other states that we've discussed so far, has some pretty clear metrics on how we go from red phase to yellow phase, and then hopefully eventually to green phase. And the governor issued that, and where counties have fewer than 50 new confirmed cases per 100,000 population, that's when they can transition from that red phase to the yellow phase. But they also, in addition to having those lower case counts, need to be able to test everyone who has symptoms, including all frontline workers, and make sure that they have room in hospitals to handle a likely influx in hospitalizations. So we've talked about the likely increase in cases, but we have to think about the fact that that comes with also the increase in hospitalizations. Mm-hmm. So it's important to note that once a county does move to yellow, it doesn't stay yellow. It doesn't just go from yellow to green. It can go back to red whenever we see that resurgence in cases. And yellow phase, which sounds like a luxury at this point, still has a lot of restrictions around it on what businesses can be open and when. And there can still only be 25 people in gatherings. So we would still be seeing things like major reunions and events that would be canceled.
So what about Philadelphia? Where are we in Philadelphia with the new cases? Like you said, 50 per 100,000. Doesn't seem like we're anywhere near that.
You're definitely right, Laura. So we're actually about 10 times that, between 10 and 15 times the amount of cases. So based on the governor's most recent order that extended our stay-at-home order in the greater Philadelphia area to June 4th, and the waves of reopening plans that have been laid out, it looks like we wouldn't be able to go to the movies or dine in at a restaurant until early August, but we might be able to start shopping at our favorite local small businesses, our local physical activity shops in early July, as long as that current order isn't extended. But again, if we see an increase in cases during those waves, we would revert back to a stay-at-home order. So it's really important for people to remember that once we start reopening and we move to yellow, that we need to still make sure that we're sanitizing our hands, washing our hands, wearing masks, and social distancing as much as possible to make sure that we can keep moving forward and not have to revert back to that stay-at-home order.
So I have one more question for you. So one of the favorite activities of people in Philadelphia is, as we all know, to go to the shore in New Jersey. What do you think is the likelihood or the advisability? Because I know they are opening up some beaches in New Jersey. What is the advisability of Philadelphians flocking, as they always do, to the New Jersey shore this summer?
So I'm a person who always steps back and lets other people see what happens first. So I would say for all Philadelphians, let's wait and see what happens with New Jersey. And if they're doing well and they seem like they are able to manage crowds appropriately and people are social distancing like they should be, then we can go take our weekend at the beach. But I would say just let's see how it plays out first. And don't be the first one to crowd on the beach. I know beaches in Florida have instated some maximum beach capacity. So that might be something that ends up having to be put in place to make sure that people can maintain social distance from other families or other groups at the beach.
Okay. Wise advice. So Sarah, if we start really reopening here in Philadelphia in some measured way, but your workplace calls you back to work, but you feel unsafe for a variety of reasons, your underlying health condition, your age, whatever, what would you suggest people do? I mean, how should they handle this?
I think a lot of people are going to have a lot of anxiety about returning to work safely. As you said, some are going to have had, comorbid conditions that might put them at higher risk. Maybe they lost a loved one to COVID-19. Some may be concerned about finding a safe daycare to send their children to. All of these are very anxiety producing. So if people have to go back to work, I think the first thing they have to do is take care of themselves and what they have control over. So, taking care of yourself through all of the means that we've talked about, washing hands, etc. But we should also do things like stay home if we feel sick, avoid other employees' phones or desks or office equipment, like don't go over and pick somebody's pen up or use their phone. Probably, I think most importantly, know what to expect of yourself. So if you're experiencing a lot of emotions after returning to work, that's, completely normal. So talk about it. Talk to someone that you trust to process the situation. Just take care of yourself and kind of be gentle. I think the second thing is to just try our best to communicate with our workplaces and our bosses about our concerns and help them think about how to comply with the recommendations that would protect us. We do have some rights. So there are CDC and OSHA guidelines for employers on COVID-19. So try and, as much as we can to be active in that process, I think is important.
Thank you. I think that's really good advice. And so now what I'd like to do is throw this question out to everyone. It's obviously been a long 2 months and it's going to continue. I know we all are sort of saying to ourselves, will we ever be returning to life as it used to be in the reasonably near future? What do you all think? Because I do believe that expectations are important, and if people know where they're going, it's easier than if they have unrealistic expectations. Heather, you were going to say something.
Yeah, Laura, I don't like to be the bearer of bad news, but I don't think we're going back anytime soon to like normal. And with 2 little kids at home, I have a really hard time thinking of not sending them to school in September. But I've been coming to terms with it that really might be the case, and we might be homeschooling for quite a long time. And I think, like you said, mentally preparing yourself helps, and like coming up with strategies and systems, and like leaning on friends for ideas of how to keep kids busy and getting them into routine so that they also understand it's normal. But I personally don't think that, like, schools may not open up in September, and I wouldn't be surprised if they don't. So that's one thing I've been kind of grappling with in terms of the future.
Are there people's thoughts on this, like where we're headed?
I would like to talk a little bit about the fact that we have to be on the alert until we have a vaccine. And until we have a vaccine, the virus is not going to go away. COVID-19 is not going to go away, and we'll have to keep paying attention and taking measures. But on the other hand, I always have a rosy picture, and I feel like, you know what, this is a great opportunity for us to look at the future and make changes. What has been happening has really highlighted gaps in healthcare that we have, gaps in the way we deal with, people who, the essential workers, gaps in health disparities. So we can rethink that. So we should be also thinking about, life is never really going to be, we're never really going to go back to life as it was before, but we may create a better life also. So let's be positive about it.
I mean, I think that social expectations may change a bit, so just thinking about things like shaking hands or hugging people, just all the time, that sometimes we might think about those. I mean, I do think change is difficult for people. It was hard to adjust to being on lockdown, and now it's going to be kind of hard to adjust to being back out in the world. But people in general, from my perspective, are pretty resilient, and they can adapt to changes as long as we're clear about what those changes need to be.
Mm-hmm. Mm-hmm. Other thoughts about it, Krys?
Yeah, I think that it's just really important to let people know that the better we are at social distancing and not shaking hands and making sure we're sanitizing hands and keeping those case numbers down, the quicker we're going to get back to some semblance of normalcy and actually being able to go see now those end of summer movies that would be coming out. So it's important to stay hypervigilant about making sure that you're keeping yourself healthy and helping to protect other people, because that's going to get us back to that sense of normalcy quicker than anything else.
Mm-hmm. Well, I think all these are good thoughts, and I do think that we just have to sort of do what we need to do, see how it goes, and be prepared to pull back if we need to. And definitely, probably shaking hands was never very sanitary, and perhaps we should dispense with it on a permanent basis. So I think that's it for today. Thanks for joining us. To hear last week's panel, a few other videos, and find links to reliable information, please visit cph.temple.edu/coronavirus.